Well, good morning. How you doing? Welcome to another question and answer Friday. We appreciate it. And we'll say hello to a few folks this morning. Got lots of questions, so that's a good thing. And hold on here now. Let's just say hello to John from Elgin, Illinois. Good morning. Mike from Norland. Renee, Nova Scotia. Hey, praying for you guys in Nova Scotia. Rosalinda, Niagara Falls. Francis Marie. Nick. Yeah. Evangeline. And Eileen, Georgina, Ontario. Carrie, Nebraska. Wendy, Markham. Rosa, good morning. And Rita, good morning, Nouveau Brunswick. I don't know if you guys are getting, I think it's going to be farther east, eh? Mary and Tina, Nova Scotia. Sue, Anne, Moncton, New Brunswick. Newfoundland, Donna. And Deb, Timmins. Jackie, still waiting on the storm in New Brunswick, Jackie says. Micheline, bonjour. And Barbara, Kansas. Bill, Faye, Terrace, BC, bright and early. Sandy, Washington State, bright and early out there. Cleveland, good morning. And Sandy from Chilliwack, BC. Diane, Thunder Bay. Maria, Georgie, Halifax. Yeah, we're really praying for you guys out there. Lorraine, Fran, Orangeville. It's cold in Sudbury. Sharon, and Yolande, bonjour. Frost this morning. Robin, and Karen, and Rita, good morning. We appreciate it. And stay safe out there, Crystal and Etta on the East Coast. And Nicole Milika. And hey, Doc. Dr. McEwen on with us this morning. Rita, Surrey, BC, Jan. Okay, let's get going. Suzanne, Edmonton, Maggie from Florida. Mary, PEI. You guys be careful out there. Edith, Lisa. Okay, let's get to the questions this morning. Rose is asking if storing supplements where they are to direct sunlight will affect the supplements. Well, it depends what kind of bottle they're in. I mean, our supplements are in a protective type of bottle, so I don't think the sun is going to damage them too much. I think if you probably had a clear bottle, the sun could do stuff over a period of time to a supplement, I guess. If you're concerned about that, put them in a cupboard. But generally, Rose, I'm not too concerned about it. It's certainly not with our supplements anyways. Monique says, I would like to comment, or like Dr. Martin to comment on the possible synergistic effects of his clinic supplements. Well, synergistic meaning working together, right? Yeah, I mean, I'm a big guy on, look, we put out a video not long ago called The Fabulous Five, our favorite 5 supplements, in the sense that, we sort of, like, me and probiotics, Navitol being our flagship product. I'm a big guy. Oh, you should have seen the new study on DHA that came out yesterday. I'll probably comment on it next week. The brain and DHA. We always knew that high DHA oil is tremendous. But there is synergistic stuff. Like if you look at, for example, and I've done this on podcasts in the past, talked about high DHA with Navitol or high DHA with curcumin, just studies that show its effectiveness. Probiotic, basic, works synergistically in a sense that helps you to absorb nutrients even more, a good broad spectrum probiotic. So yeah, I mean, there's a lot of synergistic. I'm trying to think. A lot of synergistic happens within the supplement. I'll tell you why, Monique, because I put formulas together in, like you rarely see anything like high DHA, of course, is a fish oil. It's a very specific fish oil. But just about every other supplement, I put like Navitol, we put in some, the other vitamin C, not coffee. We put in some ascorbic acid from the acerola cherry, and because it has synergistic properties, if you look at our cortisol formula, I got 8 different ingredients in there, and there's a reason for that. They do work synergistically. Like, look at our inflammation formula. I got 8 anti-inflammatories in there that work synergistically. So, yeah, within the formulas themselves. Okay, good question. Thanks, Monique. Dale, what does Dr. Martin think of ozone therapy? Well, I don't dislike it. I think if someone, for example, had cancer and they had the resources, I would get it all, man. And one way to do ozone, well, the best way to get ozone therapy is IV. So, do I like it? Yeah. Do I think it's the best? No. No. Like, you have to understand, Dale, where I come from, okay? So, with me, good, better, best. Okay? Good. Yeah, it's good. Ozone therapy. But are there things better? Yeah. Glutathione IV. Better than ozone. So, you see what, like me, I sort of have categories. So when you ask me a question like that, you know, if I didn't do it in my practice, that didn't mean I didn't like it. But I have sort of protocols that I developed over the years, and I find those things to be the best. So if you asked me about a certain condition and said, what do you think about ozone therapy in that condition? I would tell you, yeah, but there may be something better. Okay, so it's a good question, Dale, but you know, I don't want to be negative on it. I just, if it's not part of my sort of my repertoire, it's because there's something better than that, in my opinion. Brenda, pushing the lawnmower for 15 minutes and sweat pouring off of me. Me too. Well, depending, Brenda, on how much, you know, how hot it is. But you're asking the question, is that good or bad? Well, it's not bad. You know, you're pushing the lawnmower. You're sweating. Some people sweat more than others. It's just who they are. I'm going to tell you, Brenda, about me. I dehydrate very quickly. I just know that. I'm very hypersensitive to it because I've been sort of monitoring myself. I dehydrate in a short period of time. Okay, I'm very active still. I still work out, and I love playing ball in the summer. I still love playing slow pitch, and I, you know, And man, oh man, when it's hot, like I dehydrate very quickly. So be careful with that. And that's like, you got to replace that. A lot of people don't realize how much when they're sweating, they're not only losing water, they're losing salt. You're losing electrolytes. That's why, you know, I'm very careful for me. But it's not a bad thing. It's the way I'm built. And some people don't dehydrate as quickly, but they still dehydrate, and sometimes they're just not aware of it. Dehydration can be dangerous. You have to be careful about that. Make sure you're getting enough fluid and put salt in the water. Bobby, a friend has pancreatitis, bad health, introducing her to reset. Well, that's the best thing you could do for pancreatitis. People get look, I mean, you can always get an infection or whatever, but pancreatitis, why do we see so much of it today? Well, because we overuse our pancreas. Our pancreas, it's going 24 hours a day for most people because we're carboholics, we're sugarholics. And the pancreas is, you know, it's not only releasing insulin, but the other function of the pancreas is to release enzymes, digestive enzymes. So pancreatitis, I would have her on your friend, Bobby, the reset. What foods to avoid? Sugar. Sugar. Honey, sugar. No sugar, for sure. And crappy carbs, and, you know, let the pancreas, the reset allows the pancreas to go on a holiday. But I would get her to be on digestive enzymes too. Deborah. Dr. Martin, if arthritis in the joints forms uric acid crystals, which I see, or used to see frequently, if yes, can a medication to remove uric acid control painful joints? No. Usually, well, look, one of the things they usually give you is alpurinol. Look, I'm not saying, I'm not against medications, but if you got problems or someone has problem with uric acid, you got to start with food, not with medication. Like, what is the biggest thing forming uric acid? Fructose. And in this day and age, it's high fructose corn syrup, the antichrist of sugars, terrible for you, terrible for the liver. It loves to park in the liver. And when that gets all gummed up, you're forming uric acid. As a byproduct of that, your body can't secrete it, and you get uric acid crystals. They can cause stones. 25% of all kidney stones are uric acid crystals. A lot of people don't realize that. And they're drinkers of fruit. Either fructose. Worst thing you can do is you're meant to eat fruit, not drink it. And don't even eat a lot of fruit if you're making uric acid crystals. And usually where you find those are on the, you know, the distal joints in the feet or the toes, but in the fingers where you got some deformity there. A lot of times people go, well, that's osteoarthritis. Yeah, but it's uric acid. It's a form of gouty arthritis. So I'm not big on the medication in long run at all because there's a lot of side effects to it. And you need to really start with food and drink, like drink water and coffee. Coffee is very good for uric acid. Did you know that? Yeah. Okay. Thanks, Deborah. We appreciate it. Sonia. She developed type 1 diabetes after many years of having pernicious anemia under control. Is there a connection? Yep. They're both autoimmune. And guess what, Sonia? They started years ago in the gut. There's never a case, in my opinion, of any autoimmune that doesn't start with leaky gut. leaky gut, leaky, you name it. So there is a connection. And pernicious anemia, type 1 diabetes would be connected through the gut. Through the gut. Toxins getting into the gut. They're starting to prove that I was right a long time ago, talking about leaky gut. So that's what I believe the connection is, Sonia. And what should I do to protect myself from other complications? Well, if you need to be living a very, very low or no carb diet. Type 1 diabetics, I know it's autoimmune, but they don't get along with carbs. They have an allergy to carbs. They need protein, 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 and fat. They need the animal kingdom. And I'd be on broad spectrum probiotics? Absolutely. And I'd even have you on my insulin balance. Now, Giovanna, familial hypercholesterolemia. And what are you saying? I was told my cholesterol levels are very high. Yeah, well, look, that's a genetic thing where you have high cholesterol. Now, I'm going to beg to disagree with Google. Because if you Google it, I agree, it's genetic, and you build up cholesterol. And look, I gotta tell you this, Giovanna. I'm not in agreement that cholesterol, even though you're genetically predisposed to it, increases your risk of heart disease. It's the other factors that go along with it. Yeah, you make more cholesterol. Is that a bad thing? Nah, I don't see it. Because they hammer in on this condition with LDL. LDL is, you got high LDL, genetics for high LDL. Well, if you made LDL the boogeyman, and that'll scare the life out of you. But I would tell you what you need to be careful of, Giovanna, and you have some genetics, okay, I get it. But you need to be very careful of your diet. And it's not cholesterol that's gonna kill you. It's inflammation. And it's high circulating insulin that destroys your blood vessels. Cholesterol are always going to be flowing through your blood vessels. Even if you don't eat any cholesterol, you're going to have cholesterol flowing through your blood vessels. Why is that? Because they're FedEx trucks, or they're Canada Post, or U.S. Postal Service, or Amazon trucks, or whatever. They have a job to do. They have to deliver, including your LDL. They deliver hormones. And they're at, you don't blame police because they're at the crime scene. You don't blame firemen because they happen to be at the fire. They're not the problem. So again, I look at it differently, okay? And you got a genetic condition, they're going to scare the life out of you. But to me, if you keep your diet, you stay in good shape, and you're going to do well. You're going to do well, Giovanna. Because I've seen it before, and people, they get the life scared out of them. And they're on meds, and anyway. Okay. And yeah, a hereditary liver problem. That's exactly where cholesterol is made. Yeah, in the liver. So empty your liver. Glenda, what causes a raw sensation inside the mouth, top to bottom lip, similar to the feeling when you eat too many salt and vinegar chips? Well, don't eat too many salt and vinegar. I like that, Glenda. Started about 4 days ago. Well, look, I mean, it could be a multitude of things. Look, anything around the mouth, I usually look at B12. Okay, so Glenda, I don't know you. I don't know your history. I haven't seen your blood work. At least I don't think I have. I am always suspicious. Any paresthesia, anything around the mouth, could be zinc deficiency to some extent, but more often than not, it's B12. That's the thing that sticks out at me. If it's only been going on for 4 days, but I would be suspicious of B12, okay? Having low levels of B12. Okay. And Glenda's saying when she goes up the stairs, I love this, her knees sound like Rice Krispies. Snap, crackle, and pop. Don't eat that stuff, whatever you do, because then you'll snap, crackle, and pop. Now listen, I'm not too worried about that crepitus. We call that crepitus, cracking sounds. And look, keep your joints lubricated. I'm a big guy on DHA for lubrication. You might need an oil change, Glenda. Change the oil. Lots of DHA. I'm big on that. But if you're not getting a lot of pain, I'm not too worried about it. Okay, Bonnie, if you have food, coffee in your stomach, and drink water later on, how does it take a different path with everything else in you, inside of you? Bonnie, I like your thinking. You're thinking. And you're listening. Water takes a direct route. When water is water, it takes a direct route. You're built, fearfully and wonderfully made, you're built. Water goes directly to the bloodstream in a short time. It don't pass go. And yeah, you got food in your stomach, but so what? You still got room in there. And that's going to take a beeline. Soon as it gets into your small intestine, it takes a curve that doesn't go through the rest of the digestive process. It takes a curve, a quick right turn into your small intestine and right away into your bloodstream, whether you got food or not. Because your body knows it needs water. You're like planet Earth. You're 75% water and salt. Okay? Seriously. So, yeah, I'm glad you asked the question. Bonnie made me laugh a little bit because I'm thinking, man, you've been listening. Good for you, Bonnie. But water gets there rapidly. Whether you take water with food or not. Look, I like, getting back to water for a second. I like water, especially first thing in the morning. I drink 2 liters of water every day. If I sweat, even more. But I drink 2 liters. It's the sweet spot of water. Absolutely. Okay? And the first one is really important because you're very dehydrated in the morning. So I do not allow myself to have coffee without the H2O. I just don't. It's a habit. Do I like coffee better than water? Yeah, I do. But discipline, drink water. And you men out there who are big babies, oh, Dr. Martin, I don't like the taste of water. Too bad, so sad. Drink water. You need it. The 60,000 miles of blood vessels are screaming for water. Make the river go, man. The river of life. Okay? And suck it up, buttercup. You need it. I don't know why I'm picking on men this morning. Okay. Okay, Diane, I have an overactive bladder. Okay? Help. Well, Diane, why do you have an overactive bladder? Okay? And that's what you got to get to the root of. Okay? I'm going to give you a couple of ideas. One, you got estrogen dominance and two, not enough progesterone. That you have an imbalance in hormones. I would knock down your estrogen. That has a major effect on a woman's bladder. Okay? Progesterone for smooth muscle. Your bladder is a smooth muscle. Get your insulin down. Insulin is a growth hormone. It's an inflammatory hormone. Estrogen, insulin. Insulin is food. Okay? Now, sometimes there can be yeast in a bladder. Leaky gut, leaky bladder. Very common in women. They don't, I don't know, I don't think I have a, yeah, but you're up peeing, your body's trying to get rid of it. Your body's trying to get rid of that yeast. Like when men pee frequently, it's their prostate. It ain't the bladder. They got a prostate. And it swells, it grows with insulin and estrogen too. But when women get it, oftentimes it's yeast sitting in that bladder wall. And your body's smart. It's just trying to get rid of it. Let's pee it out. Okay? And don't feed the bears. It'll lower your insulin when you're not eating sugar and it helps your bladder. Okay? Good question, Diane. Rosa, what is the connection between thyroid and bulging eyes? Well, usually I've seen bulging eyes in goiter, right? Where you get a real inflammation of the thyroid, and then your metabolism is out of whack. It can give you bulging eyes. I've seen that many a time in the office. And we do all of the above to get that condition. Remember, insulin is such a huge growth hormone. And you got to start in the kitchen. You got to start with the diet and get off the carbs and get off the sugars. That really makes a difference in the thyroid. Empty the liver, because the thyroid, the conversion of T4 to T3 occurs mainly in the liver. And then you need cholesterol to carry that T3. So I'm just saying, like, it gets back to basics. And you might, I'm big on probiotics because the gut needs to be good too. Okay, so there's a lot of connection there, Rosa. Janet, what is your opinion on colonics? Yay or nay? Nay. Look, I'm not 1,000,000% against colonics, but I'm very careful with colonics, because the problem with colonics, yeah, you're giving your bowel a scrub, but now you're wiping away your microbiome there. And I'm very careful. People do that, and I tell them, okay? Like if you had bowel cancer, maybe, but I don't talk about colonics too much because I'm not a big fan. I'm much bigger on you want to help your bowel, quit eating so much fiber and blocking it up. Get off get off the wheat, get off the fiber, get off the sugars. Drink enough water. You want to do a colonics naturally? Water. And bone broth. I love bone broth because it helps to regenerate the bowel. So, okay, probiotics. There you go. Thanks, Janet, for the questions. Francis says, I have high heart enzymes. I'm on the reset, wondering if it will help this. Yep. If you got heart enzymes, you got inflammation. If your enzymes, heart enzymes are up, you got inflammation. You want to lower inflammation. The reset lowers inflammation. Insulin drives inflammation. Watch your cortisol. Get cortisol down, Francis. Because that stress hormone will make that inflammation. It pours gasoline on the inflammation around your heart. I love high DHA. It lubricates like nobody's business. Your brain, your heart, your joints, your skin. Eat steak. Good for the heart muscle. Okay. Diane, here's a good question because I'm going to answer it going back to earlier. She's asked, can a person take colloidal silver instead of an antibiotic? Look, okay. Good question, Diane, because it gets me to what I was talking about earlier. First of all, let me talk about an antibiotic. If you got a raging infection, you need an antibiotic, okay? Now, we talked about this. You take the antibiotic until the raging infection, the symptoms are gone, diminished. Can you use colloidal silver? Yep. Be careful. I've seen it where people took too much of that stuff. Now, I'm going to tell you what's, okay, so the antibiotic, I wouldn't dismiss an antibiotic because if you need it, if you got a kidney infection, you need an antibiotic. You got a raging infection, you better get an antibiotic. I'm not against that at all. If you have no symptoms, then you can avoid an antibiotic, okay? But you got to sort of play doctor by yourself on this. But let me say this, Diane. You know what? Colloidal silver, look, I've been around a long time. Believe me, that was the hottest item. You know, every once in a while, you get, colloidal silver from your nose to your toes. It fixes everything. And no, it don't. Okay? No, it don't. But I'm not against it. No. I'm going to tell you something that's better. See, colloidal silver is all right, but you want to know what's best? Oil of oregano. It's a better antibiotic. It's a better antiviral. It's a better. I'm telling you. Because I've seen both. And in my clinic, and I'm going to tell you, there's nothing better on the planet as far as a natural antibiotic than oil of oregano. I haven't seen it. Okay? I haven't seen it. But I have a lot of experience with it. So that's all I'm saying, Diane. You like colloidal silver? I'm not against it. Do you get rid of an antibiotic? You don't need an antibiotic, or do you need one? Again, I can't tell you, but other than my choice would be oil of oregano. Okay? Now, good question, Stephanie. Breast implants. What do I think about them? Well, no, you're not asking. Oh, your implants are causing pain and tons of symptoms. Well, look, you don't want to get them out. Not an easy task. A lot of people, women decide to take the breast implants out. There's leaking of those breast implants. But here's the thing that I've counseled women in the past with breast implants. You're taking breast implants, you need to detox any possible side effect from that. And that's why I'm a big guy on probiotics. If there are strains of probiotic bacteria that are on your side. They will protect you from toxins like nobody's business. Keep your liver clean, because your liver is a big time detox organ, because it produces glutathione. Keep your liver empty, and your liver will work on your behalf to keep the garbage, the poison out of your bloodstream. Probiotics, empty the liver, the reset, big time good for you. Okay, thanks, Steph. And Jenny, what? Oh, we got a lot of questions here. I got to get going. Okay, we'll get there. We'll get there. Okay, Jenny, with taking supplements and also vitamin D, does insulin resistance diabetic, does a person have issues with absorbing vitamin D? Not insulin resistant. Look, as you get older, you absorb less vitamin D. If you're a sugar eater, you're going to hurt your levels of vitamin D. Fructose, that bad high fructose corn syrup. Avoid all that kind of stuff, Jenny. And you might need to take more vitamin D depending on, your individual needs. And the best way to find out really is to see what your vitamin D levels are in your bloodstream, your dehydroxy-25. Find out. It's worth, even if you have to pay for that test, get it done. I would do it once a year. Find out where your vitamin D levels are. Your doctor, they're not thinking vitamin D. They don't care. They don't understand. Because all they can think of is vitamin D in the bones. They don't think about it as what it does for everything else. You're a human solar panel. So find out, Jenny. And there's things that can create leaky gut, for example, and not enough good microbiome has an effect on absorption of vitamin D. Okay? No, Julie is confused. No, wait a minute. Charlene, I think I answered your question, right? Frequent urination at night. Okay, already covered that. So Charlene, sorry, I didn't see that earlier, but I think I answered your question. Thank you very much. Julie, I'm confused, she said. Don't be confused. But Julie's confused about the email sent out about the triglycerides to HDL. TG divided by HDL. And 1 is what we're aiming for. Look. Okay? Now listen. Okay? Listen. Again. And I want to take the confusion out of it. Always aim. The minimum is your triglycerides. Some people think that's the best. Triglycerides and HDL are equal, 1 to 1. Okay? But for me, optimize, and that's what that email says. Optimize, okay, so good is 1 to 1. Never want to have triglycerides lower than your HDL. Okay? Yeah, excuse me, the other way around. You never want your... I'm a senior. You never want your HDL to be lower than your triglycerides. Some colleagues of mine who understand all these things too, they like 1 to 1 ratio. My experience is this. I like HDL to be higher than your triglycerides. So before I look at any specifically at triglycerides, I want to see that ratio. And I want to see optimized HDL, meaning it's up and above, up to 2.5 times even better. Optimize it. But if they're equal, and look, they always talk about getting a woman's triglycerides under 1 and getting a man's triglycerides under 1.50. I'm not against that. All I'm saying is this. It depends on that ratio. If you just send me your triglycerides, it don't mean too much to me because I need to see both those numbers. I need to see your triglycerides. I need to see your HDL. And look, you Google this and you'll hear a lot about different ratios. But for me, 1-to-1 is all right. But if your HDL is higher than your triglycerides, in my opinion, you're in real good shape. Okay? So maybe we could have clarified that maybe a little bit better. Always advise triglycerides to be 2.5. Okay? Higher than wait a minute. Dr. Martin has always advised triglycerides times 2.5 is good HDL. Yeah, I think you're right. Again, I'm just wondering about the wording, Julie. But at the end of the day, here it is. You want your HDL to be high. And you want your LDL to be high too. That's a little secret I'll let you in on. And you want your triglycerides to be lower than your HDL. That's what I look for metabolic syndrome, okay? Good question, Julie. Rita, what is the optimum time for sun in the AM for melatonin production? Well, about 20 minutes. 20 minutes. 10, 15, 20 minutes sun. You don't, it's for melatonin, okay? Different than getting vitamin D. Vitamin D, you got to have your arms exposed. You have to have your legs. Look, it comes in elsewhere, but the biggest solar panels are found on your arms and your legs for vitamin D. Okay? So sunbathing, getting out in the sun, doing the gardening, and all this and that, okay? Good luck with that now while we're in Northern Ontario. We didn't get the memo about climate. I guess we did. The climate is changing. It was frost this morning. Okay? But melatonin's about 10, 15 minutes of sunlight in the eyeballs. Don't go looking at the sun. Just let the rays of the sun make melatonin for you. What does Dr. Martin think about magnesium bicarbonate water? That's putting... magnesium bicarbonate is liquefied magnesium. Do I like it? Yeah, I like magnesium. You got to be careful when you're drinking magnesium. See, you're drinking magnesium on its own. You got to be careful about that because you don't want to take too much magnesium. I'm a big guy on trace mineral. I like my favorite magnesium. I got to tell you again, magnesium bicarbonate. Yep, good. I like the best absorbing kind. Your body likes it because it's chelated. That's called magnesium citrate. Now, different magnesiums do different things, reportedly. But I want the one that's absorbed the most, and that's why I'm a big guy on citrate. Now, look, citrate, if you take too much of it, for some people, it can cause a little bit of digestive issues and diarrhea. Well, then you just bring it back a little bit. If your body's telling you, okay, you got enough, and come back a little bit if you got a little bit of digestive issues. But it's the best form, in my opinion, because I used to see it in my office and what works the best in terms of magnesium. Magnesium bicarbonate on its own, yeah. The best? Nah. Not the best, but it's good, okay? And be careful, because with that, you don't want to throw your heart off or whatever when you're taking, because that's a concentrated magnesium. Rosalind, since I bleed very easily, how far before my surgery should I stop taking 2 capsules daily of your DHA? Well, look, there's 2 things. Your doctor, generally surgery, stop all supplements, stop any what they call blood thinners. DHA don't thin your blood. It lubricates. DHA doesn't thin blood. It lubricates your blood vessels. There's a difference. Okay? It doesn't stop you from clotting, but doctors don't know that, so they're going to tell you to stop. And, you know, even if you read on the label or whatever, that's Health Canada. Health Canada, I love Health Canada, except when they're wrong. Okay? And they're often wrong about supplements because they don't know anything about them. So they put all these warnings out. Okay? But you're asking a question, and if you're scared, then stop it before surgery. But to me, you're going to heal better. You're going to go through your surgery better, in my opinion. And don't stop probiotics, whatever you do. Okay, and again, I'm not supposed to say that, but I said it. Okay, getting near the end here. Okay, Denise, subacute thyroiditis. Well, we talked about it. Inflammation of the thyroid. We talked about it. Do all of the above. Anti-inflammatory diet. Keep your liver clean. Get your insulin down because insulin makes things grow. Estrogen dominance in women. Be careful. Get that estrogen down. Balance it out. Those are all things, Denise, that you can do. Okay? Julika, how are you? What supplements should I take? Hormonal or menopause? I still have hypothyroidism and belly fat are my symptoms. Okay? Reset for 2 years. You've been doing the reset, Julika, for 2 years. You got belly fat. Well, I would tell you, and your thyroid still, well, you got hormones. Depending on how old you are, look, you might want to take the menopause too because that'll elevate your progesterone. The hormonal formula will knock down estrogen. I got a lot of women taking both. And, you know, depending on, Julika, it sounds like you got issues with that thyroid. And take the thyroid formula. You might have to do all of the above, but you're certainly eating the right way, Julika. You're eating the right way. You're doing the right thing. You're saving your bacon. And sometimes cortisol can have an effect on that thyroid, especially with belly fat. Belly fat usually in a woman is cortisol. You have fat receptors in your belly 4 times more for cortisol than for anything else. Okay? We talked about that earlier this week. Okay, I think I'm done. Okay. Guys, have I told you lately that I love you? I haven't? Well, I do. We appreciate you guys. Thanks for all the questions. They're such good questions. I mean it. Okay? And we've got some great things coming next week. So tell your friends. Get them to join the Martin Clinic Facebook group. Don't be shy. Okay? We'll talk to you soon. We do love you.